Welcome to our deep dive on the fentanyl crisis. We're taking a closer look at this LinkedIn article. It's called The Fentanyl Surge, a National Emergency.
There you go.
It's written by David Vogel. And he's a, well, kind of interesting guy. He's a retired CEO, but also a pastor and a pretty influential voice on LinkedIn.
Oh, wow. That is an interesting combination.
Yeah. And that's actually one of the things that makes this deep dive so fascinating. We're not just getting dry statistics. Vogel brings this multi-layered perspective. He weaves in his own personal experiences, but also historical context and even global comparisons.
So he's not just saying, here's the problem. He's trying to get at the bigger picture.
Exactly. He's making the argument that our current U.S. drug policy is just not working. It's failing. And he makes a pretty strong case for a complete, radical shift.
I'm intrigued. So where do we start?
Well, he starts with the hard facts, and they're pretty grim. Over 107,000 drug overdose deaths in the U.S. last year, 2022.
Wow.
Yeah. And fentanyl was involved in almost 70% of those.
That really highlights the urgency of the situation.
It's not just addiction we're talking about. It's the potency of fentanyl, right? Just 2 milligrams, that's all it takes to be lethal.
Mm-hmm.
We are dealing with a public health crisis here, and it's massive.
Yeah, I mean, you can't ignore those numbers.
And then there's the economic cost. According to the CDC, it's over $1 trillion a year.
$1 trillion?
Yeah. The healthcare costs, lost productivity, the strain on our justice system, it's a huge burden. Mm-hmm. And even President-elect Trump is calling it a national emergency.
That's significant, right? It shows this isn't a partisan issue.
Exactly. This is something everyone's concerned about.
Okay, so we've established it's a huge problem, but where's all this fentanyl coming from?
Well, the article explains that most of the the chemical ingredients, the precursors, they're made in China.
Okay. Then
they get sent to Mexico where the cartels process it.
Makes sense.
But here's the thing that surprised me, and this is straight from the DEA. Over 80% of fentanyl gets into the U.S., not through some, secret route, but through legal points of entry. It's hidden in commercial vehicles.
Whoa, so it's not just about sealing the border then?
Right. It makes you question how effective that strategy really is. Vogel actually has a good point about the limitations of border security in general. I mean, the U.S. has over 95,000 miles of coastline, plus huge land borders. You can't patrol all of that effectively. Drugs are coming in by land, sea, air, even underground tunnels.
Wow, so it's way more complex than just building a wall.
Exactly. It's like trying to plug holes in a sieve. He even mentions that the Coast Guard seized over 500,000 pounds of cocaine just from vessels alone in 2022. That's just cocaine. Imagine fentanyl.
It shows you how adaptable these trafficking networks are.
Totally. Like squeezing one part of a balloon, right? That other part just bulges out somewhere else.
Yeah.
Even Newt Gingrich, someone not exactly known for being soft on crime, admits that physical barriers aren't enough.
So we tried that with cocaine back in the 80s, right? Shifted the routes from the Caribbean to Mexico.
Yep. Focusing on border enforcement just ignores the fact that drug trafficking, it's like water. It finds a way. So we've got to look beyond that, which leads us to the big one, the war on drugs.
The dominant strategy for, over 50 years now?
Yep. And Vogel argues, pretty forcefully, that it's been a colossal failure.
It's important to remember the context. The war on drugs was launched by Nixon in the 70s, focused heavily on law enforcement, arrests, punishment.
Right. But one thing that stuck with me from the article is that this war on drugs was, from the get-go, it was riddled with racial bias.
Oh, absolutely. Vogel actually quotes John Ehrlichman, one of Nixon's top advisors, who later admitted the whole thing was designed to target and disrupt Black and anti-war communities.
Yeah. It's chilling when you think about it. We poured over $1 trillion into this effort. And what do we have to show for it? Sky-high addiction rates. And a prison system, let's face it, disproportionately filled with minorities.
And it's not just Vogel saying this. Critics like Ron Paul call it an abject failure.
It's enriching the cartels and ruining lives. Makes you wonder why we're not doing something different.
Well, the article really dives into those systemic inequities the war on drugs has created. Like the ACLU reports that African Americans are over 3 times more likely to be arrested for marijuana possession than white people, even though usage rates are pretty similar.
It's crazy, right? And that disparity doesn't stop at arrests. It continues with sentencing. Even former Attorney General Eric Holder called out the war on drugs as racially biased.
Yeah, and those biases have lasting consequences. Barriers to re-entry into society, the cycle of poverty and incarceration.
Al feeds into that cycle. But, okay, if we step back from the war on drugs, let's look at history for a second. Prohibition. It never really works, does it?
The classic example is the 1920s, right? Banning alcohol didn't stop people from drinking. It just empowered organized crime.
And it's the same logic with drugs. The DEA estimates Mexican cartels are making $39 billion. That's billion with a B annually, just from U.S. drug sales.
Wow.
And you think of the human cost, too. The lives lost, families torn apart, the wasted potential. We got to try something new. So Vogel starts looking at what other countries are doing.
Interesting. What's he find?
Well, one example is Switzerland. They have this program. It's a heroin-assisted treatment program.
Yeah, hold on, you mean they're actually giving people heroin?
Yeah. Sounds kind of crazy, right? But the results are amazing. They've seen a 64% reduction in drug-related deaths. And they've almost completely eliminated HIV infections related to heroin use.
That's incredible. So they're treating it as a health issue, not a criminal one.
Exactly. And it's way more effective. It's like we've been so stuck in this one way of thinking, this war on drugs mentality, that we're ignoring these other solutions that are actually working.
It's like we're so focused on punishing the problem that we're not even trying to actually solve it.
Exactly. And then Vogel brings in his own personal experiences. This is where it gets really powerful. He spent some time in prison and saw firsthand how easy it was to get drugs, even in maximum security.
No matter how much you try to control the supply.
Right. He saw them coming in through corrupt staff, visitors, drones, even baseballs thrown over the fence, stuffed with drugs. It proves that as long as there's demand, people will find a way to get it.
So what's the solution then, if we can't just arrest our way out of this?
Well, this is where Vogel gets to the heart of it. He says we have to address the root causes of addiction. And get this, the U.S. only spends about 2% of its drug control budget on treatment and prevention.
2%. That's shocking.
I know. Most of the money's going towards enforcement and incarceration. We're basically ignoring the things that could actually help prevent addiction in the first place or help people recover.
It's like trying to put out a fire by only focusing on the flames and ignoring the fuel that's feeding it.
Right. Vogel points to Portugal as a model. In 2001, they completely decriminalized all drugs. And get this, they shifted the focus from punishment to harm reduction and treatment.
And what happened? Did drug use explode?
Nope. They saw a huge drop in drug-related deaths, HIV infections went way down, even overall drug use decreased.
So it's not just a crazy idea. There's proof it can work.
Right. And it makes you think, why are we so resistant to change here in the U.S.?
I think, honestly, part of it is stigma. We're so quick to judge people who use drugs that we don't see them as needing help. They're just criminals.
Yeah, that stigma runs deep. And there's this idea that if we show compassion, it means we're condoning drug use.
When really it's the opposite. Compassion is what helps people get better.
Exactly. And this is where the conversation gets even more complicated. Because Vogel makes the argument that our efforts to curb opioid addiction, restricting those prescription medications, it's actually backfired.
Interesting. How so?
Well, think about it. The crackdown on those prescription opioids like OxyContin, it was supposed to address overprescribing, right? Get people off those addictive painkillers.
Yeah, that was the idea.
But what they didn't account for was what would happen when people lost access to those prescriptions.
They turned to something else.
Exactly. And in this case, that something else is often fentanyl. It's cheaper and more readily available on the black market.
So we shut one door without opening another, and people fell through the cracks.
That's a good way to put it. And what's really scary is that the black market is flooded with these counterfeit pills. They look like regular painkillers, but they're laced with fentanyl. The DEA estimates that 60% of these counterfeit pills tested in 2023 contain potentially lethal doses of fentanyl.
So someone thinking they're getting a familiar painkiller could be taking a fatal dose without even knowing it. It's terrifying. And it's happening because we haven't dealt with the demand side of the equation. People are still in pain, they still need help, but we've made it harder for them to get it safely. This crackdown has actually made the problem worse.
And who benefits from this? The cartels.
Exactly. It's like we've unintentionally handed them a winning lottery ticket. They can make these pills cheaply and easily, and the demand is through the roof because we haven't addressed the underlying issues.
So what's Vogel's solution? What does he propose we do about all of this?
That's what we'll dig into in the next part of our deep dive. We'll take a closer look at those alternative solutions and what a real shift in drug policy could look like.
So we've seen that the war on drugs just hasn't worked. It's actually made things worse in a lot of ways. But what's the alternative? Where do we go from here?
Well, I think one of the most important things is changing our mindset. We have to stop thinking of this as a like a criminal justice issue and start seeing it as the public health crisis it really is.
Okay, so we've got to shift our focus.
Yeah.
But what does that look like in reality? What are some actual solutions?
One thing that comes up a lot is expanding access to medication-assisted treatment. We call it MP. It uses medications like methadone and buprenorphine, and they've actually been really effective in helping people reduce their opioid use.
I've heard some people say that it's basically just replacing one drug with another.
Yeah, that's a pretty common misconception. But MAT is it's medically supervised, right? Helps people get off those more dangerous opioids and stabilize their lives. It's not about getting high. It's about giving people a chance to recover.
So it's a tool, like a stepping stone, to help people get back on their feet.
Exactly. And we also need to remember that addiction is complicated. It's often connected to other issues like trauma, mental health problems, and poverty.
Right, so it's not just about treating the addiction itself. We need to look at the whole picture.
Yeah, it's got to be a holistic approach. So things like access to mental health services, job training, stable housing, those are all critical. We have to create a support system that gives people the tools they need to actually rebuild their lives.
It sounds like we need to focus more on prevention, too. Catching people before they fall through the cracks.
Absolutely. Early intervention is key. Educating young people about the dangers of fentanyl before they even start experimenting with drugs. Supporting families and communities that are already struggling. We've got to address the root causes of addiction, not just react after the fact.
Makes sense. But if these solutions are so effective, why aren't we already doing more of them?
Honestly, I think a lot of it comes down to stigma. We still view addiction as a moral failing, like it's a choice people make instead of a complex medical condition. And that stigma, it prevents people from seeking help, and it also makes it hard to pass good policies.
So how do we break down that stigma?
By talking about it,
Yeah.
openly and honestly, sharing our stories, challenging those misconceptions, and treating people who use drugs with compassion.
Okay, so education and changing how we think about addiction, those are important. But what about harm reduction? That seems to be a pretty controversial topic.
Yeah, it definitely gets some pushback. But harm reduction is all about minimizing the negative consequences of drug use. Even if someone isn't ready to quit completely, we can still help them stay safe.
So what would that look like in practice?
Well, think of things like needle exchange programs. They provide clean needles to people who inject drugs, which helps reduce the spread of diseases like HIV and hepatitis C.
I can see why some people might be uncomfortable with that. It might seem like we're encouraging drug use.
I get that, but the research shows that these programs actually save lives. And they give us a chance to connect with people who use drugs, offer them resources and support, and hopefully guide them towards treatment.
Okay, so it's about meeting people where they are, not judging them.
Exactly. Another important harm reduction strategy is safe consumption sites.
Oh, those places where people can use drugs under medical supervision.
Yep. That way, if someone overdoses, there are trained professionals right there who can intervene. Studies show that these sites reduce overdose deaths, and they actually decrease public drug use, too.
It's kind of like seatbelt laws. We know people are going to drive cars, so we implement safety measures to reduce the risks.
I like that analogy. That's what harm reduction is all about, recognizing that people are going to use drugs and figuring out how to keep them as safe as possible. It's not about condoning drug use. It's about saving lives.
I get it. But these harm reduction programs, they're not always well received, are they? Why is there so much resistance?
Well, part of it is the stigma we were talking about, but there's also a lot of misinformation out there. People don't understand how these programs work, and they assume they're just enabling drug use. But the truth is, they're actually an important step towards getting people the help they need.
Okay, so we need to educate people, get the facts out there. Now, I want to talk about decriminalization and legalization. Those terms get thrown around a lot, but what do they actually mean, and how do they fit into the bigger picture?
Good question. Decriminalization means removing criminal penalties for possessing small amounts of drugs for personal use.
So you wouldn't go to jail for having, like, a little bit of heroin on you.
Right. It doesn't mean drugs become legal, but it does mean we can shift resources away from law enforcement and put them towards things like treatment and harm reduction.
And legalization.
Legalization takes it a step further. It means regulating and controlling the production, sale, and distribution of drugs, kind of like how we do with alcohol or tobacco.
That seems like a pretty radical idea.
It definitely is. But proponents argue that it would take the market away from those dangerous criminal organizations, the cartels. It could also reduce violence and generate tax revenue that we could use to fund treatment programs.
So it's about bringing the whole industry out of the shadows and trying to control it. kind of like what happened with alcohol prohibition.
Exactly. And history has shown us that prohibition doesn't really work. It just creates more problems.
But wouldn't legalizing something like heroin be, I don't know, super risky?
It's a complex issue, for sure. And there are definitely risks to consider. We'd need to think carefully about how to do it safely and responsibly. But, cannabis legalization has gained a lot of momentum in recent years.
Yeah, more and more states are making it legal, either for medical or recreational use.
Right, and that could open the door for a broader conversation about how we approach other drugs.
Sounds like we need to have a much more open and honest conversation about all this.
Mhm.
We can't just keep relying on the same old strategies that haven't been working.
I agree. It's time to look at the evidence, learn from other countries, and be willing to try new things. The status quo is costing us too many lives.
Now, Vogel also talks about how even well-intentioned government policies can sometimes make the fentanyl crisis worse.
Oh, yeah. He brings up the crackdown on prescription opioids. While the goal was to reduce overprescribing, it kind of backfired.
How so?
Well, when people suddenly lost access to those prescription painkillers, many of them turned to the black market to get their fix. And that's where fentanyl comes in.
So trying to limit the supply actually increased the demand for a much more dangerous drug.
Unfortunately, yes. It's a classic example of the law of unintended consequences. We try to solve one problem, but we end up creating another, even bigger problem.
And in this case, it's people's lives that are at stake.
That's why it's so important to think carefully about the potential consequences of our policies. We need to be smart and strategic, not just reactive.
So if prohibition and just focusing on supply isn't the answer, what is? What's the best path forward?
Well, we've touched on some of the key elements already. Treating addiction as a health issue, not a crime. Investing in prevention and early intervention. Expanding access to treatment and harm reduction services. And having those honest, sometimes difficult conversations about decriminalization and legalization.
It seems like a huge undertaking, changing the entire way we think about and approach drug policy. It can feel kind of overwhelming, to be honest.
It is a big challenge, no doubt. But it's not hopeless. There are things we can all do to be part of the solution. And that's what we'll talk about in the next part of our deep dive.
Okay, I'm ready for it. Let's talk about what we can do to actually make a difference. Okay, so we've talked about the problem, and we've talked about some potential solutions, but I think the biggest question a lot of people have is, like, what can I actually do? This feels like such a huge issue, it's hard to know where to even start.
I hear that a lot. People feel kind of helpless, like their individual actions won't really make a difference. But that's just not true.
So what can we do? Like, practically speaking, how do we get involved?
Well, first and foremost, educate yourself. Learn about the crisis. Read articles like the one by David Vogel. Understand the root causes, and the different solutions that are out there.
Okay, so knowledge is power. But then what?
Talk about it. Have conversations with your friends, your family, your coworkers. Share what you've learned. Because a lot of times the biggest obstacle is just that people don't understand the issue.
Right, like there's so much stigma and misinformation surrounding addiction.
Exactly. So the more we talk about it openly and honestly, the more we can start to break down those barriers and create space for some real change.
So we got to challenge those stereotypes and misconceptions.
Yeah. And remember, addiction is a disease. It's not a moral failing. So treating people who use drugs with compassion, that's a big part of it too.
Okay, so we educate ourselves, we talk about it with others. What else can we do?
Well, there are a lot of great organizations out there doing amazing work on the front lines. You can support them, volunteer your time, donate, or even just help spread the word about what they're doing.
Right, like those groups providing treatment and harm reduction services, or those advocating for policy changes.
Exactly. Every little bit helps. And don't underestimate the power of contacting your elected officials. Let them know that this is an issue you care about and that you support evidence-based solutions.
So we can use our voices and our votes to push for change.
Exactly. But there are also things you can do on a more personal level in your own community.
Like what?
Well, think about the people in your life. If you know someone who's struggling with addiction, just be there for them. Listen to them. Offer your support without judgment.
It's hard though, right? Like, what if you've never experienced addiction yourself? How do you even begin to understand what someone's going through?
You don't have to have all the answers. Just being there, listening, offering a kind word, that can make a world of difference. And if you're worried about someone, encourage them to seek help. Let them know they're not alone.
Yeah, sometimes just knowing that someone cares can be a huge help.
Exactly. And if you are struggling with addiction yourself, Please reach out for help. There are people who care about you. There are resources available. Treatment works. Recovery is possible.
That's such an important message. We need to remember that there's hope, even in the midst of all this tragedy.
Absolutely. There are stories of hope and resilience everywhere. People who have overcome addiction and are now helping others. Communities coming together to implement innovative solutions. It's happening.
It's inspiring, right? It shows us that change is possible. But it takes all of us working together.
Exactly. We can't just sit back and wait for someone else to fix it. We all have a role to play.
Well, I think this deep dive has been incredibly eye-opening. I've learned so much, and I hope our listeners have too. It's clear that we need to change the way we think about and approach this crisis. We need to move away from punishment and towards compassion and support. We need to prioritize prevention and treatment, and we need to be willing to try new things.
I agree. It's time for a paradigm shift. The old ways just aren't working.
It's time to embrace those evidence-based solutions, those harm reduction strategies. It's time to invest in the things that actually help people. It's time to start saving lives.
Well said.
So to everyone listening, thank you for joining us on this deep dive. Keep learning, keep talking about this issue, and keep pushing for change. Until next time.